everyone, I'm your anchor Pooja, and I welcome all of you all to the Hair on Air podcast series. Today, we're going to be discussing about the importance of hair on our head and how losing hair can change your look completely and drastically. Hair is definitely an essential element for our hair to look beautiful, and we all are in this Insta age where we all want to look perfect. Today's podcast will be focusing on how we can have beautiful and healthy hair to look hair smart and how losing your hair can still be regrown back. And to educate us today on this important subject of taking care of your hair, growing your hair, and how to prevent hair loss, we have amongst us a very renowned dermatologist and trichologist from Mumbai. Please welcome Dr. Nikita Jadhav. Dr. Nikita, welcome to our show here on Air podcast.
Hi, how are you?
Very good, doctor. How are you doing?
I'm doing good too. My name is Dr. Nikita. I'm a consultant dermatologist and cosmetologist practicing in Mumbai.
Awesome. So, doctor, before we really deep dive into the subject of hair care, hair loss, please tell us a little about your journey. What really inspired you to, choose dermatology and trichology?
So, how it started was that I never planned to be a doctor.
Okay.
When I was a kiddo, my parents were like, she'll be a doctor. So it was always the kids, the toys, and all those with me, which had the doctor, stethoscope, and everything. And I used to play around. And over a period of time, I really realized that, that's a great service. And then it just went in the flow. I got to know that I got an admission in MBBS, followed by doing my MD. And I never till MBBS, I wasn't sure. But then, if you ask me, I always wanted to be into a non-emergency field. And my liking for skin, hair was really, I enjoyed the postings that I always had in my dermat department.
Oh.
So that's how my interest in dermatology. And then over a period of time, the journey taught me a lot of things. And I'm very happy that I chose this actually.
Glad your parents dreamt of you to be a
Yeah,
doctor and you
yeah,
picked it up.
yeah.
And here we have Dr. Nikita with us.
Thank you.
So, doctor, when we talk about hair, I think it's everyone's dream कि हमें silky बाल चाहिए, beautiful hair चाहिए. लेकिन beautiful hair आज की तारीख में with this changing weather and so much of lifestyle changes possible नहीं हो पा रहा है. So, क्या कर सकते हैं to have beautiful hair? I'm sure all my viewers would love to know that.
So first of all, getting beautiful hair is something that you need to take care of yourself internally. It's not always that what you do externally.
Yeah.
Like grooming is another part, but having a healthy hair is something I promote the most.
Okay.
So having good food, eating on time, sleeping on time, doing workout once, 1 hour at least a day, and be very clean with your gut.
Okay.
So these are something, very basic.
Yeah.
People used to do this
Yeah.
from early. Now people have got used to other things.
Yeah.
But internally, if you ask me what cleansing for hair is, then this is what I recommend. And grooming, people having like a good wash, good blow dry and all, that all is something that is very external.
Yeah.
But I feel that internally, good supplements and good food is something that I feel gives your hair a healthy look. Or a
Absolutely.
good keeping hair healthy. I like hair to be more healthy.
Okay, that's
Yeah.
absolutely right, doctor. Keeping the hair healthy is essential, and what you are from within is what shows out. Absolutely rightly pointed out. So, doctor, if we look at hair fall now, is it the age that is contributing to hair loss, or is it the lifestyle? What is it exactly?
If you ask me about age, then at every age, hair fall is there.
Okay.
There is something called as abnormal hair fall and a normal hair fall.
G.
So it depends on the strands that you're losing.
Okay.
Okay. If you're considering age, then generally, if you see in adolescent age group is the commonest.
Okay.
Because that's the reason when your hormones post puberty starts getting active, that promotes oil production and then the hair fall starts.
Okay.
Then it happens with late 30s and 40s because of the lifestyle,
Okay.
which induces nutritional deficiency, stress.
Okay.
Then comes the aging ones, which has like typical grade, like there are gradings of hair fall, and then the severe grades are seen with the geriatric group. So
Okay.
if you consider age, every age has a hair fall. There is
Yeah.
no particular age.
Yeah.
You find hair fall above 12 years with everyone.
My God, I think that brings me to the next question that I've heard nowadays. hair loss is happening at the age of 18, and you said it's even after 12. So is there a right age to really look at hair fall, baldness?
Yes. See, ideally depends. The phases of hair fall is different. So I prefer that if you are losing 50 to 100 hair per day,
Okay.
then you need to give an attention.
Okay.
If it's just that 4 5 strands are coming around, that generally happens because if wherever you are staying now,
Yeah.
nowadays there is construction everywhere, there is dust, there are cars, there
Yeah.
are a lot of external factors, environmental factors which are involved. So
Correct.
losing 5 10 hairs here and there is always going to be there.
Yeah.
But I feel that if it is more than 50 to 100,
Okay.
then probably you need to give an attention to your hair fall.
सो डॉक्टर आई थिंक कहना आई अंडरस्टैंड 50 to 100 बाल, लेकिन कहाँ पर हम नोटिस कर सकते हैं 50 से 100 बाल कब गिर रहे हैं? इज इट लाइक नहाते वक्त, इज इट कोम करते वक्त, लाइक कब हमारे व्यूअर्स को एक्चुअली स्पेशली ये जानना होगा कि व्हेन कैन दे रियली रियलाइज कि हाँ अब हेयर लॉस हो रहा है, फॉल नॉर्मल नहीं है?
So whenever a patient approaches me,
जी.
or what I've observed from my patients,
Right.
is that whenever they are always like it's on the pillow, it's in the basin, it's on the floor.
Yeah.
If you like, if I try to gather them, it's going to be more than 100, ma'am. It's going to be more than 100. This is what they generally are.
Yeah.
So I have given them this technique that the day one you're going to lose, you have to collect it.
Okay.
Do the treatment,
Okay.
collect it after 1 month. So when you collect and keep it in zip pouch and put a date, you yourself get to know post treatment how the volume is going down with the medications.
Yeah, right.
So if you want to notice how much are you losing, then the whole day you have to gather whatever you see it on the floor. That is
okay.
what that's how I ask my patients, normal patients, like everyone, to analyze the hair fall so that they know.
Very important point, doctor. I think analyze करना, अपने hair fall को observe करना and collect करना, that's quite an
Right.
important point. I like that. So, doctor, hair fall हो रहा है, okay? We all are experiencing. पर इसको रोकने के लिए क्या किया जाए? किस तरह की treatment पर नज़र रखें? आपने कहा कि अच्छा खाना खाना ज़रूरी है, diet पर ध्यान देना है. So, is it like diet में सब कुछ नहीं मिल रहा है आजकल because खाना is not natural? So, is it like we need to supplement it? क्या करना चाहिए, especially with the nutrient therapy?
Hair supplementation,
जी.
which contains biotin, iron,
Okay.
these are basic nutrients.
Okay.
Everyone needs it.
Okay.
You get it through food, but you get it minimally.
Right.
So at least you need to know what are the good sources. If people are non-vegetarian or vegetarian, then accordingly you have to choose. But if the patient is non-vegetarian, they get a lot of things through non-veg, which has omega and proteins, which is important for hair growth.
Yeah.
But there comes the variegation for vegetarian people.
Yeah.
But then in the form of sprouts, soya, paneer, seeds, nuts, they get it. But still, when you consume, you have to consume it in a certain amount to give that much of milligrams to your hair.
Yeah.
That you cannot do through food. So that's when the supplement comes into picture. So definitely supplement plays an important role, but there are limitations and there are flushing periods to give the supplements. You cannot keep on having them.
Right. Right. So supplement लेने का भी एक तरीका है, and ideally approaching a doctor is essential, of course.
Of course, yes.
And what I understand, doctor, is from what you've just explained कि nutrient therapy भी लड़कों और लड़कियों के लिए, male and female के लिए अलग अलग होंगी, right? Because females have other problems, males have others. So what is it like? How different is it?
See, the girls post-puberty gets into a menstruation.
Right.
So at times now the PCOD has so much increased. So irregular menstruation is a very common problem.
Correct.
And because of that, they are losing on the excess, the important iron levels through hemoglobin.
Yeah.
So when it comes to differentiating the male and female supplementations, it's mostly that with female supplementation, the ferritin levels, the iron levels are induced, folic acids are induced within the supplements.
Okay.
As with men, it's not required. They can give ferritin levels also, but its majority, it's with female supplementation. That's the difference.
Okay. So, doctor, another hair fall problem जो हमने सुना है is dandruff हो रहा है. So, क्या dandruff से भी hair fall होता है?
The answer to this question is yes. Dandruff is a problem which happens when the fungus is growing on the scalp. Now, where does the fungus comes from? So, natural fungus and bacteria is there on the skin. It's a natural flora which is 2% there.
Okay.
Now, whenever the fungus grows, it needs 3 things to eat. That is your skin, water that comes through sweating, and the oil. So all these three things become food for them. And whenever puberty comes in adolescence, that time the oil production increases, and then the oil production when increases because of hormonal changes, the dandruff, like the fungus, thrives on that, and that's how the dandruff increases.
Right.
So that is the major reason that the spores which covers the hair try to break the hair from the scalp. So
Okay.
dandruff is one of the major reason for hair fall, and that's not only with the adolescent. Everyone who has oily scalp
Okay.
can develop dandruff, and people think that dandruff can be treated
Yeah.
permanently, but no.
Okay.
2% of natural fungus always stays on the scalp.
Yeah.
So whatever is eradicated is ideally 98%. The
Okay.
2% always stays, and you have to maintain it through showering at least thrice, then properly cleaning the scalp,
Yeah.
drying your hair regularly.
Yeah.
If you keep your hair wet through, again there's a water.
Yeah.
Then if it is sweaty,
Yeah.
all these things. So dandruff is not only the antifungals that you give and treat it.
Yeah.
You need to make lifestyle modifications to not keep your scalp wet for a longer time to avoid the fungal growth.
So, doctor, you just mentioned about keeping the hair clean and shampooing. So, we've heard there's a specific content in the shampoo like ketoconazole and ZPTO, I think. So, is there something specific that we should advise the viewers? किस तरह का shampoo use करना चाहिए for their hair?
So first thing is that antifungals is important. So any molecule that contains antifungal is very important part in anti-dandruff shampoos.
Right.
For example, ketoconazole or laliconazole. Now these are the molecules which work as an antifungal. So they try to work like they cut off the fungus multiplication, then they kill them also. So it is fungicidal as well as fungistatic. Number one. Number two, ZPTO, sulfur, coal tar, salicylic acid, this all works as keratolytic agents. So what it does, keratolytic is it breaks the skin. Lysis is breaking and kerato is skin. So when you break the skin, it detaches the one skin layer, and that's how it removes the dandruff.
Okay.
So some shampoos are plain antifungals, some comes in combination. But one and important thing that patients needs to know about antifungal shampoo, it is purely used for scalp hair only. You are not supposed to use this shampoo all over the hair.
Right.
People do the mistake of putting it all over the hair. You just need to put it to the scalp and then just 1 inch above the scalp. Keep it for like 5 minutes and then wash it with the tap water. That is how ideally the anti-dandruff shampoos are supposed to be used.
Okay. Awesome. So point to be noted, doctor. Doctor, dandruff हो गया, shampoo की बातें हो गई. Something about baldness. Like आजकल baldness भी बहुत तरीके की दिख रही है, especially in males. I've seen किसी को circular baldness होती है, किसी को back side में baldness होती है. तो क्या difference है and क्या reason है इसका?
So people like male generally start losing hair from the center area is because the blood circulation there is less. So whenever they lose the hair from the top end of the scalp, it's probably because the receding starts from the center area, and then it just goes on centrifugally. It just goes from center to the corners, and then there are grading. Grade 1, 2, 3, 4, 5, 6, 7.
Okay.
So 6, 7, if you ask me if baldness is happening, then yes, in 19 to 20, 25 years maybe baldness hota hai.
Yeah.
But then it is grade 2, 3, where they say that, the hair are thinning and scalp has started getting visible. But they go up to grade 5, 6, 7, that is the typical baldness by the age of, 30, 35, 40 also.
Okay. Okay. So, doctor, if somebody who's experiencing baldness, I'm sure there are treatments available. So, what sort of treatment is, suggested for which kind of, hair loss or hair thinning, or for that matter, baldness? Is there a specific treatment for each?
Coming to the baldness, if it will never happen that the patient will completely go into the baldness and then come for the treatment. Patient generally are aware that the hair are thinning and scalp is visible.
Right.
So then the first approach is that they'll go and meet a dermat, and then they will get counseled about what is happening to their hair. Why is it thinning out?
Yeah.
So it is not directly the treatment. It's basically counseling, scanning the patient, and then telling them that you are going through this. If you don't make the changes, then it's going to be worst. And if you are counseling them well, that which is very important, because they need to know the factors which are causing the baldness.
Right.
Most of the times there is no reason, but it is just genetic.
Okay.
So at times you need to counsel the patient, which is very important. And then second part is starting then on the treatment. That includes, as we rightly said, initially we have mentioned about nutritional therapies. We are going to start it on that.
Okay.
And also some applications which has some molecules. For example, Redensil, Aquaxil, there is Capixil, Procapil, Anagen. These are some molecules which also promotes on hair growth and also reduces the hair thinning.
Okay.
There is some molecule which is also known as minoxidil. It has got its own, like it has its amazing effects, but it comes with a side effect, and it's the medicine should be counseled before giving to the patient.
Okay.
And it is something which goes on a long run basis.
Right.
So, if the patient are counseled well,
Ji.
then patient gets ready for the treatment and then they start on it. And any hair treatment patients are taking, they have to give at least 1 to 2 years for the growth to be visibly seen. The first thing that they need to know that hair is a long run treatment.
Yeah.
They should be psychologically prepared to take that.
Absolutely.
And of course, if the growth comes, there is always maintenance. Your hair, your skin, your body is a maintenance. If you don't maintain it, you think this is permanent, this is how it is going to be. It is not like that. You need maintenance for everything.
Right.
Yeah.
So obviously there's no quick fix to anything. There is a procedure to be followed. So I understood about the tropical treatment that you mentioned, but I've also heard about few more procedures. So is there some specific condition where you really go to the next stage of advising which procedure to be done?
Yes. In hair now, when you patient finishes the treatment or patient's ongoing treatment, but certainly patient yourself is mentioning to you, like, that these are the treatments I know in the market. Are you doing it?
Yeah.
But my catch on that is ki if it is required, I'm recommending you.
Okay.
So in that case, what we promote is mesotherapies.
Okay.
So the mesotherapies are in the form of meso boosters, which are stem cells which we inject. Also, there is something called as PRP, which is known as platelet-rich plasma,
Ji.
and also termed as GFC, which is a growth factor plasma. So in that case, PRP and growth factor are the same procedures. It's just that with PRP, the procedure is like, we counsel the patient, then we ask the patient to lie down, we collect their blood, we transfer the blood from the syringe to a test tube. That test tube is then put into the centrifuge machine, run on a certain speed, because of which the blood and serum separates. And then that serum contains the growth factors and the platelets. So that is injected back on the scalp. So growth factors promotes the hair to grow from the roots. This is the basic mechanism of PRP. With GFC, the kit contains a solution which has excess of growth factors already.
Okay.
So that adds on the increase.
Okay.
So these are injectables, but if patients are not comfortable with injections, then there is something called as derma pen and derma rollers.
Okay.
So this derma pens and derma rollers, we move over a skin. So this derma pen or the derma roller contains the needles. So needles prick the skin. Because of the prick, it creates a passage for the solution to enter the scalp.
Okay.
So if the patients are not comfortable with injectables, then we can do the derma roller or use derma pen, and then we can infuse that solution inside the scalp.
Okay. My personal question, doctor, are these treatments painful by any chance, so that my viewers know and can probably undergo it without?
Yeah,
having to
everyone's
fear?
pain threshold is different.
Yeah.
So for derma rollers and derma pen, I personally plan to put anesthesia, and that's what is recommended also. For 45 minutes we anesthetize the scalp, and it's a local anesthesia. So we do that for the patients, but with injectables it's not required. It's as minute pricks.
Okay.
And patient has to undergo that. And I think if the patient is counseled well and they are comfortable, the first session is always going to be a difficult task, because psychological they don't know how it's going to come to them. But once they know in one session now, then they get very comfortable in second, third sessions. Like it's all about how doctor is interactive, how they are keeping them diverted. It's all about your expertise in that.
Absolutely. So, doctor, what I understand is even before reaching to the final stage of hair transplant, there are a lot of treatments that one can undergo, right?
Yeah.
So, is there a specific case, or when you really decide that this patient will have to undergo a hair transplant, anything like that?
Yeah, if the patient has already undergone a grade more than grade 5,
Okay.
like it's grade 5, 6 and 7.
Okay.
For male, And for female pattern baldness, if that's called as Ludwig's alopecia,
Okay.
in that case, a female has a typical Christmas tree pattern of, baldness.
Okay.
In that case, yes, transplants is recommended, but transplant is not something that is, always required to be, full scalp.
Yeah.
Some patches where you are not growing hair,
Yeah.
in those areas also patches wise transplant can be done. So it all depends upon, if the patient is really a case where transplant is the only option, you
Right.
guide them well,
Right.
then yes, patients are comfortable doing the transplants.
Okay. Doctor, we've always heard since childhood that, hair fall can be controlled or probably hair can be nourished with hair oiling. Is that really true?
Oil for me is just a good moisturizer for hair. I haven't seen any patients having a growth with oil and all. Like, a lot of oils are available in the market in the form of almond oil, castor oil, and everything. But I prefer that oiling is a very beautiful moisturizer. The way of using oil is very important. I recommend my patients to use oil just for 1 hour, but they should not have dandruff. That's the clause. If you have a severe hair fall and if you have a dandruff, then oiling is not suggested, because that adds up to the fungal growth and that adds up to more hair fall. No one puts the oil on the scalp without a massage.
Okay.
So manipulating your hair is a big thing. So
Right.
manipulation is a wrong technique, actually.
Yeah.
So just use a little bit of oil, just take it on your palms, take 2 to 3 fingers, apply all over your scalp, keep it for 1 hour before your bath and just wash it off. It is an amazing moisturizer.
Okay.
But if you keep it overnight, it has nothing like, for the growth or anything. It's just, it doesn't work that way.
Yeah.
1 hour is good enough.
Yeah. Okay.
Yeah.
So, doctor, are home remedies really effective in controlling hair fall?
Some home remedies do help for hair fall.
Okay.
If you ask me baldness or alopecias, the answer is no.
Okay.
Hair fall is different, hair thinning is different, hair growth is different, and baldness is different. So if you ask me, some people are losing hair like 15-20 strands, and then they are putting something home remedies like rosemary oil, or they are putting some castor oil, almond oil, any mixtures of onion oil and all that. At certain point, those juices and all show them difference, that 25 hairs are not falling.
Okay.
But if you ask me from the baldness point of view, home remedies don't work. At times medications takes a lot of time, so home remedies is out of question.
Okay.
For baldness it doesn't.
Okay.
Yeah.
And my last question to you is drinking alcohol, smoking, a part of unhealthy lifestyle, as we say, also contributing to hair fall?
Not directly.
Okay.
Alcohol, smoking, and other lifestyle disorders, if you consider, then a lot of hormonal changes comes through the lifestyle. That hormonal changes now makes a lot of inflammatory cells active.
Okay.
So the oxidative stress starts growing up in the system.
Okay.
So it's indirectly causing your blood and oxygen to go to your hair less. So it's an indirect cause to it. Directly it doesn't. And if everything, see, now that's the lifestyle for everyone.
Yeah.
Right? Certain age group from 25 to 45, everyone are into some or the other way of addictions to distress themselves. That's the fact.
Absolutely.
So when they're doing it, and they are doing it under a limitation, and they know how to not make it a lifestyle issue, then definitely it won't bother. But if it's habitual, then yes, the things are going to affect after a certain point of time. But it's not directly.
Absolutely. So every habit does have its side effect clearly on ourselves and our hair.
Yes.
So, Dr. Nikita, I think you shared a lot of valuable insights of multiple treatments and so much more that we can do with hair. So, if somebody has to really approach out to you, please suggest our viewers where they can reach out and what sort of treatments do you have in your store.
So I'm a consultant dermatologist and I'm practicing in Mumbai. The location is Lalbagh. I'm available for patients to reach me on Google, Practo. Also, the services that I'm giving, my majority is about consultations, but I also have an aesthetic practice. So in that, we do lasers for the patients and also the mesotherapies, which include skincare and hair care both, also for the body care.
Okay. So I'd really like to thank you, Dr. Nikita, for sparing in your valuable time with us at the Hair on Air podcast series. I'm
Thank you so
sure all
much.
my viewers are definitely going to take benefit out of this entire session and the valuable insights that you've shared. And I'd also like to thank our viewers for staying tuned in at the Hair on Air podcast series. For more such information on hair care, on promoting hair growth, and of course, looking hair smart, do tune into Hair on Air podcast series. We're available on YouTube, Instagram, Spotify, and Apple Podcasts. For now and for today, that's all that we have. And thank you very much. See you soon. Bye bye.